everyone, welcome back to my YouTube channel, and today we are going to talk about hyperthyroidism. So let's start our topic with introduction. Hyperthyroidism is a condition that is characterized by excessive production and secretion of thyroid hormone like thyroxine, that is T4, and triiodothyroxine, that is T3 by thyroid gland. These hormones regulate metabolism, and their excess lead to hypermetabolic state affecting nearly all body systems. It is one of the most common endocrine disorders and is most prevalent in women, especially between 20 and 50 years of age. Definition of hypothyroidism. Hypothyroidism is defined as a clinical condition resulting from excess synthesis and release of thyroid hormones by the thyroid gland. It leads to increased metabolic rate and hyperactivity of various organ systems. It should differentiate it from thyrotoxicosis, that refers to clinical state caused by elevated thyroid hormone from any source including thyroiditis or hormone ingestion. Physiological overview. Thyroid gland located in the anterior neck produces T3 and T4 under the control of hypothalamus that secrete thyrotrophin releasing hormone, and then pituitary gland that secrete thyroid stimulating hormone, and then thyroid gland that produces T3 and T4. Then there is a negative feedback mechanism that maintains hormone balance. In hyperthyroidism, this feedback fails due to overproduction or autonomous secretion. Etiology of hyperthyroidism. Hyperthyroidism can result from various conditions. There are primary causes, then there are secondary causes. Primary causes are related to thyroid gland overactivity. They may include Graves' disease, that is autoimmune disorder, and it is most common cause of hyperthyroidism. Then there may be toxic multinodular goiter, that is also called as plumber disease, and it is because of overactive nodules in the thyroid gland. It may be because of toxic adenoma, that is single hyperfunctioning thyroid nodule. It may be because of thyroiditis, that is inflammation that causes leakage of preformed hormones. Or it may be because of excess iodine intake, that is also called as George-Basedow phenomena, that is especially in susceptible individuals. Then there are secondary causes, that is because of increased thyroid stimulating hormone production. It may be because of thyroid stimulating hormone pituitary adenoma. There may be iatrogenic or exogenous causes. Uh, there may be excessive thyroid hormone therapy or fictitious thyrotoxicosis. That may be intentional or accidental ingestion. Pathophysiology of hypothyroidism. Overproduction of thyroid hormone increases basal metabolic rate, oxygen consumption, heat production, and catecholamine sensitivity. This leads to sympathetic overactivity and hypermetabolism affecting cardiovascular, gastrointestinal, nervous, and musculoskeletal system. In Graves' disease, thyroid stimulating immunoglobulin mimics thyroid stimulating hormone that causes diffuse gland stimulation. Then there are clinical manifestation of hyperthyroidism. Symptoms result from increased metabolism and adrenergic stimulation. There may be general symptoms and specific signs. General symptoms of hyperthyroidism include weight loss despite increased appetite, heat intolerance and excessive sweating, fatigue and muscle weakness, palpitation and tachycardia, anxiety, irritability and restlessness, tremors, especially hands, increased bowel movements or diarrhea, oligomenorrhea, that is scanty menstruation, and goiter, that is enlarged thyroid gland. Then there are specific signs like in eyes, there is exophthalmos, that is protrusion of eyeballs in Graves' disease. There is cardiovascular signs, that may be atrial fibrillation or hypertension. There are skin signs, as skin may be warm, moist skin, and fine hair. There are neurological signs, there may be tremor and hyperreflexia. There may be thyroid fluid, that is due to increased blood flow. Thyroid storm is also called as thyrotoxic crisis. It is a life-threatening complication characterized by severe hypermetabolism, high fever, tachycardia, delirium, and circulatory collapse. It is usually precipitated by infection, surgery, or stress. Diagnostic evolution of hyperthyroidism. First we do is laboratory investigation that include thyroid function tests in which we check serum thyroid stimulating hormone uh, and free T3 and T4. Serum thyroid stimulating hormone may be suppressed and free T3 and T4 mostly are elevated. Then we do thyroid autoantibodies that include TSH and receptor antibodies and antithyroid peroxidase. TSH receptor antibodies are positive in Graves' disease, and antithyroid peroxidase and antithyroglobulin antibodies may also be present. Then we can do imaging studies that may include radioactive iodine uptake scan that there is diffuse uptake in Graves' disease, there is focal uptake in toxic adenoma, and there is low uptake in thyroiditis. Then we can also do ultrasound, that is to detect nodules and gland size, and we can also do ECG that may show tachycardia and atrial fibrillation. Complication of hyperthyroidism include thyroid storm, that is medical emergency, heart failure due to persistent tachycardia, atrial fibrillation, osteoporosis, that is increased bone resorption, muscle wasting, infertility and menstrual irregularities, and eye complication in Graves' disease. Management of hyperthyroidism. There are general measures that include rest and reassurance, high calorie and high protein diet, include avoid stimulants like caffeine, and eye care for exophthalmos like lubricants and dark glasses. Then there are medical treatment options that include antithyroid drugs that are also called as thionamides that may be carbimazole, methimazole, or propylthiouracil. They inhibit hormone synthesis. Medical treatment may include beta blockers like propranolol that control symptoms like palpitation and tremors. It may include iodine solutions like glucose iodine that short-term inhibition of hormone release, and it is used before surgery. Medical treatment may include glucocorticoids for thyroid storm or Graves' ophthalmology. Then management may include radioactive iodine therapy, that is I-131, that is isotope of iodine, is taken orally that selectively destroy overactive thyroid tissue. It is contraindicated in pregnancy and breastfeeding. We can also do in management surgical management, that is also called as thyroidectomy. It is indicated for large goiters, suspicious nodules, or intolerance to other therapies. Preoperative preparation with antithyroid drugs and iodine is done to prevent thyroid storm. Prognosis of hyperthyroidism. With appropriate treatment, prognosis is excellent. Graves' disease may have recurrence. Some patients may develop hypothyroidism after therapy, especially in post-radioiodine or surgery. There is lifelong monitoring of thyroid function is essential after thyroidectomy. Prevention of hyperthyroidism is done by early detection through screening in high-risk individuals, by avoiding excessive iodine intake, by regular follow-up in treated patients, and by patient education about symptoms of relapse or overtreatment. Conclusion of this lecture video. Hyperthyroidism is a common endocrine disorder resulting from excessive thyroid hormone production, leading to widespread metabolic effects. Early diagnosis through thyroid function and appropriate treatment like medical, radioiodine, or surgical treatment can control symptoms and prevent complications. Patient education, regular follow-up, and multidisciplinary care are crucial for optimal outcomes. And this was all about hyperthyroidism. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.